Hello, Assalamu alaikum. I am Dr. Mereesha, a specialist pediatric dentist from Al-Shaq Hospital. Today we are going to discuss about a very important topic, that is the dental care in kids. Do you know that 78% of the kids in UAE are suffering from dental caries? And most of the parents will have a doubt that anyway the primary teeth, the milk teeth, are going to shed off soon. Is there any need of taking care of primary teeth? Yes, of course, they are going to shed off soon. But before shedding off, the primary teeth has several important functions inside the child's mouth. The most important one is chewing food. When the child is having any pain or sensitivity while chewing, he will definitely lose the interest in having food. So this will indirectly affect his nutritional status, his height gain, weight gain, etc. And secondly, the most important function of primary teeth, it guides the second set of teeth, the permanent teeth, into the proper position inside the mouth. I would say this is the most important function of the primary teeth or milk teeth. So if you don't take care of the milk teeth properly, this teeth is going to get shed soon and there won't be any tooth that is left to guide the permanent tooth into proper position. And third one, the child begins his vocabulary at the age of around 2 years, and there will be difficulty in pronouncing certain words that is beginning with S, F or V, or some words like French, teeth, smile, etc. if the front teeth are not present. So the milk teeth also plays a very important role in developing your child's vocabulary. And fourth one, it helps the child to present the society with a bright smile. It is told that the self-esteem of a child begins as early as 4 years of age, and the confidence to smile with confidence is an important factor in developing the self-esteem of the child. So these are the 4 most important functions of milk teeth. Now, the type of dental caries that is very common in children is called as early childhood caries. Early childhood caries. And these type of caries can affect your child's teeth as early as the first teeth erupts into the mouth. That means around 6 to 7 months of age and any time afterwards. So what is the role as a parent? What is your role in preventing this type of caries for your kids? The dental care for kids, it begins as early as the pregnancy itself. That is, if the mother is having many untreated cavities in her mouth, or if she is having a high rate or chance of getting caries, her saliva will be loaded with lots of microorganisms responsible for causing caries. So when the child is born, if there is any saliva sharing habits like kissing on the lips of the child or sharing the same utensils between the child and the mother, these microorganisms are going to get transmitted into the child's mouth. So this can initiate caries in the child's mouth. So during pregnancy, make sure that you restore all the cavities. The second trimester of pregnancy is very safe for restoring your cavities, and make sure that you maintain a very good oral hygiene by brushing twice daily, using a fluoridated toothpaste, usage of dental floss once daily, and also if needed substitute with mouthwash only under the prescription of a dentist. Now, when the child is born, most of the mothers will have a habit of putting the child to sleep just after breastfeeding or bottle feeding. So, when the child is put to sleep with just after breastfeeding or bottle feeding, what happens is that the milk will stay in contact with the tooth surface for a long period of time, and along with the bacteria that is already present inside, it will begin the process of decay in your child's teeth. So, as a remedy for this, I can suggest you to put some drops of warm water with the help of a dropper into your child's mouth just before putting him to sleep after breastfeeding. Now, as the child grows up, we will have a habit of introducing sugars into his diet in the form of sugar containing snacks in between the meals. This is the most deleterious habit of kids. As far as the kids of UAE are concerned, the most deleterious habit is the in between snacking between the meals. So, if you need to provide the kids with snacks, always give them just after meals, not in between the meal time. Okay, only after the meals we can give them snacks, sugary snacks if needed. Otherwise, eliminate the sugar containing snacks completely from the diet of the child. Also, you can provide them, if the child is able to spit out the chewing gum, you can provide them with xylitol chewing gums soon after eating, and chewing the xylitol containing chewing gum for 20 minutes is expected to reduce the incidence of caries in your child's mouth. So, that is all about the feeding habits and also regarding the in between meal snacking. Now we will move on to the brushing habits and the usage of fluoride containing toothpaste. The brushing of the child's teeth should be started as soon as the first teeth erupts into the mouth. There are so many types of toothbrushes, the silicone brushes, small brushes that are available that can be used to brush your teeth, child's teeth. So the brushing should be started as soon as the first teeth erupts into the mouth, and that too using a fluoridated toothpaste itself. There is a myth among the general population that we should not be using the fluoridated toothpaste that contain 1000 ppm of fluoride in child's mouth. But as per the recent guidelines, we can use the same toothpaste as we use in adults for kids also. But the most important thing that you have to keep in mind is that about the amount of toothpaste that we are using. The amount of toothpaste should be as small as a rice grain for those kids who are less than 2 years, and it should be around the size of a pea for those who are 2 to 6 years, and after 6 years you can give the same amount of toothpaste that the adults are using. So make sure that your child is brushing twice daily using a fluoridated toothpaste with appropriate amount of paste on the brush surface of the brush. And also in the night after brushing, the rinsing can be avoided. The child may be told just to spit out the foam that is present in the mouth, and no need of rinsing the mouth after brushing, so that the fluoride can stay for a longer time in contact with the tooth surface. So these are the recommendations regarding the tooth brushing and the use of toothpaste for kids. Now the third thing that I want to convey is that the fluoride content in the bottled water supply of UAE is found to be much lesser when compared to the recommended amount of fluoride that is needed for preventing dental decay. So you can substitute with fluoride drops or tablets only after the prescription from a pediatrician or a pediatric dentist if needed. So think about substituting fluoride in the form of fluoride drops or tablets if needed, only if needed, for your child after consultation with a pediatrician or a pediatric dentist. And the fourth one, schedule your child's first dental visit as early as the first tooth erupts into the mouth, and it should not be delayed beyond 1 year of age. So when the child is brought for the first dental visit, we can look into the situation of the child's teeth and educate you regarding the anticipatory guidance, like what to expect and how to take care of from an early stage itself, so as to prevent any type of dental caries or any other abnormalities that can be developed in the child's mouth. So visit your dentist as soon as possible, that is when the first teeth erupts into the oral cavity. And also regular dental visits are also advised, because there are several professional methods that can make your child's teeth resistant to dental caries. For example, topical fluoride varnish can be applied as soon as after the tooth erupts into the mouth itself, and the fluoride varnish is expected to make the tooth resistant to caries. And there are also something called as pit and fissure sealants, which can help you to seal the pits and fissures of the teeth so that no caries are initiated. So these are the professional dental services that can be provided by a pediatric dentist to your child. So thank you dears for joining this live session, and have a great day for you, the parents out there, and for those kids, have a great time ahead. Thank you so much.